Today, I want to address the importance of taking time. It's really important not to panic after you receive the news of your diagnosis. You need time to decide the best course of action for you because unless you're diagnosed with a very aggressive form of breast cancer, your diagnosis is not a medical emergency. You don't have to act the second you're diagnosed. You see, that's the old theory that every minute counted, said Dr. Susan Love when I was interviewing her on how to survive breast cancer. Dr. Love is a tireless advocate of breast cancer, and her foundation is determined to eradicate it. She went on to say that in those days they had to rush in, take care of it, slam the door so it wouldn't get out. So, in fact, by the time that most breast cancers are diagnosed, they've been sitting there 8 to 10 years anyway. So you do have time to get over the shock, to get yourself centered enough to get a second opinion, to read, to research, and to organize your life around the best way, to plan your work, your regular routine around whatever treatment decision you decide. And my interviews support that because many women who stepped back a bit instead of rushing in said, it did give them the time they needed to get over the anxiety, find their coping mechanisms so that they could think clearly through and to find the outcome that they wanted from their treatment, as well, of course, to consider all the aspects of the treatments that were recommended to them, right from the side effects to whether or not to have breast reconstruction if they decided upon the complete removal of their breast. Because just like prescription drugs, you see the advertisements on television, each breast cancer treatment presented to you does offer benefits as well as side effects. And it doesn't matter whether we're talking radiation, surgery, chemotherapy, or one of the next generation drugs that are emerging from a clinical trial. And although we sure do hope that the treatment that you're going to get is going to be that magic bullet, there's no guarantees. So this is what you have to remember. No matter what options your doctor presents to you, no matter what he or she says, you must ask questions because until a magic bullet arrives, there's still no free ride in the treatment of breast cancer. In other words, no treatment that you're going to take is without a price. You're going to have to pay some price for it. So it's up to you to make sure that the benefits you're going to receive are well worth the price you're going to pay. And that's why it's important to take time. You have to weigh the pros and cons. And of course, I'm not suggesting you take months because at some point, you have to make your decision and run with it after you do your analysis. But give yourself a couple of weeks to sit with your options and look at the potential ramifications. Look at the things that are important to you. Your quality of life. If a certain treatment, maybe some treatment drugs affect your motor skills. Maybe other drugs might affect your mental skills. If you're an accountant or something like that, but you have to ask a myriad of questions to make sure you're getting the treatment option that's best for you. Because after all, it is your body and your life we're talking about. Not theirs, yours. So don't let anyone rush you. You choose the path that reduces regrets later. And turn to someone that, not only do you trust, but look at your group of friends or coworkers, whoever it is. Look for the person that's really good at looking at something objectively and weighing the pros and cons. Turn to that person, whether it be a trusted friend, your spouse, or even someone who's been through it. That's wonderful. Someone who can be there for you and at the same time really great at weighing the options, the pros and the cons, along with who you are and what your lifestyle is. So they can reflect back your thoughts without judgment. Be aware of your options. Know the side effects, talk it over with someone that is really analytical and good at weighing the pros and cons. And this is not the time to be with someone that's judgmental. Just take good care of yourself and make the best treatment decision for you, because that's the one that's going to work best, the one that you have your heart and soul invested in. Be well.